This is a patient that I might see in the clinic. She's 35. She was very active in college. She played soccer all 4 years, injured her knee. She got her ACL and her meniscus injury and needed surgery. She had surgery, physical therapy, did really well, continued to play. And then here she is 15 years later, right? She presents because she has pain in her knee, the same knee that had surgery. Now she's having pain. She wakes up in the morning. She's noticing that her knee hurts a little bit. She has 2 young kids, loves to play soccer. She's active. After doing that, she hurts a little bit. It takes a little bit of time when she gets up in the morning to get going. She sometimes hears like a crack, snap, or pop in her knee. The knee feels unstable, right, sometimes. And so then she comes to try and figure out what's going on. Some other things that we kind of dive into as we go along is that her BMI is high, so puts her in the obese category. She works a desk job, so she sits down for 40 hours a week because of work. And because she's so busy at work and, young mom of 2, she doesn't really have time to pack lunch. So she goes to the McDonald's kind of down the road from work every day for lunch. And she also doesn't have time to exercise as much as she would like. So some things, we'll come back to this at the end, but highlighted in red are some things I wanted to point out. So hopefully at the end of our time together today, we'll be able to recognize how important osteoarthritis is, identify some risk factors for developing osteoarthritis, and then come up with a non-surgical management for osteoarthritis. But before we start, what is arthritis, right? That's the first question. Arthritis is a disease of the joint. What is a joint? A joint is a place where 2 bones meet. So if you think about it, there's a lot of joints in the body. Each finger alone has 3 joints. Like this is a joint, this is a joint, this is a joint. The wrist is a joint, the elbow, the shoulders, the spine, the hips. So there's a lot of joints in the body. And arthritis is just disease of any one of these areas. That being said, there's a lot of different kinds of arthritis. Arthritis is a big umbrella term for joint disease, but there are different specific ones. And where it affects, how it affects it, the age group, all those kind of things lead us to kind of narrow it down to one versus the other. Today, we're going to focus on osteoarthritis, but there are other types. There's rheumatoid arthritis, psoriatic arthritis, infectious arthritis, gout. And the other thing that is important to note is that someone can have more than one kind of arthritis. So a person can have rheumatoid arthritis and osteoarthritis, for example. And so again, trying to figure out what kind of arthritis, because the treatment differs depending on the cause. How does osteoarthritis come about? So we talked about a joint is where 2 bones meet. Now, to allow the fluid motion of the joints when we move, each bone surface is covered with a cushion called cartilage, right? So that when we move, the bones don't grind on each other. What happens in osteoarthritis is that cartilage starts to break down. And when that happens, the bones, because the cartilage surface keeps the bones from touching each other, then the bones get closer together. We call that joint space narrowing. And you can see that sometimes on X-ray. Sometimes people refer to that as bone on bone because the cartilage has been lost and then the bones are closer opposed together. And one of the things that the body tries to do in response to the cartilage loss, it's kind of a counterintuitive process though, is it forms new bone. So there's new bone being formed in the areas where the cartilage is lost, and we call that bone spurs. And sometimes you'll see that even without an X-ray, just by looking at the joint that's affected. Most commonly, we see them in the hands and in the knees. So this is an X-ray. On the left is a normal knee X-ray. So the bone on the top is a thigh bone, and then the 2 bones at the bottom are the shin bones. The black space in the middle of the 2 bones, that's the cartilage. The cartilage appears black on X-ray because the rays don't penetrate through because it has a lot of fluid or water. But that's what a normal X-ray looks like. You can tell that the cartilage is there. The bones are separated really nicely. And then when you compare that to the X-ray on the right, you can see how that space is lost. So that's the joint space narrowing that we were talking about previously, right? So there is a lot of cartilage loss, brings the bones closer together. And so as you can imagine, someone walking on that, it's going to grind, it's going to hurt, it might pop, things like that. And then the arrows are pointing to the extra bone growth that we talked about. We call them osteophytes or bone spurs. And so this is a picture of someone's hands who has bone spurs. If you took an x-ray, you would see the bone spurs on the x-ray, but this is the physical correlation of that. You can see the swelling at the fingertips, the joints at the fingertips. You can see how swollen those are. Those are all physical correlates of bone spurs or the osteophytes. So osteoarthritis, what can it affect? It can affect a lot of areas. It can affect, most commonly, we think about the hand, especially the base of the thumbs. So right here, it can affect the knees. It can commonly affect the spine as well. Most commonly the neck and then the low back. It can affect the hips, usually felt as pain in the groin. It can affect the knees, the big toe. Really, it can affect any other. These are the most common joints that are affected, but it can affect anywhere else if there's been trauma or surgery to that joint.